agenda.
Mike, I did rearrange some things, so I have more time than I originally expected.
Okay, great. I appreciate it. Okay, great. It's 10 a.m. We'll get this going this morning. I just want to welcome everybody and appreciate it. Mike Hurley, the Wellfleet Police Chief and Emergency Management Director, myself and Chief Pauly. The intent of this morning, just to give the community an update from our emergency management team. Each department will give an update, and then we will take questions. With other town meetings, this is kind of a new platform for us, so just be patient with us. And if the questions can pertain to the departments, and if we do not have the answer, we will try to get it for you if it's within our purview and our department. So Chief Pauly, I don't know if you had any opening comments.
Thank you, Chief Hurley. I'd just like to thank everyone who is here for participating, and hopefully this will be beneficial to everyone.
Great, thanks, Chief. All right, we'll start off with Hillary, our health agent this morning, on an update on the town's situation and her department's response.
Good morning. I'm going to apologize in advance in case you see one or two children pop up in the screen. I have them locked away in a bedroom, but they may come out at any time. So to start things off, we do have a handful of cases in town. The Department of Public Health has asked that we no longer give out the exact numbers of patients in our town that are testing positive. So we have to work through that a little bit to see how we're going to release this information. The information does get transmitted to the fire chief so that his crew and the police department crew can remain safe when responding to calls. In Barnstable County, we currently have 173 positive cases. In the state, we have 5,752 cases, and we've seen 56 deaths in the state. Okay, honey, go in and see if Matson can help you with that, okay? Or take some water. Sorry. Okay, so obviously the stay-at-home advisory is still in place. We're asking people to only go out for essential needs, to get some fresh air and exercise, to go to the grocery store, to go to the pharmacy. We are still encouraging social distancing when out doing those things. Please maintain 6 feet minimum between yourself and other individuals around you. The Mass 211, if you dial 211 on your cell phone or your home phone, you will get the state EPIs and you can ask them any question you may have. So if anything pops up, that number is manned 24 hours. And if there is a long wait, you can leave a message and they will call you back in the order that you called them. So that is a good resource. Additionally, you can text COVID MA to 888-777 for state updates. And we have a mental health helpline at 877-870-4673 for those needing some help with mental health services. Additionally, if you do not have a primary care provider and you are experiencing the symptoms, which are fever, cough, or shortness of breath, you can call 508-862-5595, and the phone will be picked up by a primary care provider off-site that you can report your symptoms to, and they will walk you through a process to either seek testing or just stay home. And those are some good options for folks that are out there. Just keep those numbers close in case you need them. And again, we're going to encourage people to wash their hands with hot soapy water for a minimum of 20 seconds. If you go out, please do avoid touching your eyes, your nose, or your mouth. You want to clean your surfaces frequently and regularly that you're touching a lot and that other folks in your house are touching. And you want to cover your mouth, of course, when you cough or sneeze. And please just stay home and avoid contact with other people. Those are the most important things you can do to prevent the spread of this virus. With that, I think I'll stop for now. I can tell you more about our departmental operations if folks are interested in that, but I will hold that for any questions people may have.
Okay, great. I appreciate it. So you can hang on for a few then. We can do
Yes.
the questions at the end.
Yep.
Okay, great. Wellfleet Department of Public Works. Mark or Jay, are you guys on?
I could speak on the transfer station too, Chief, if that's,
Great. Yep, I appreciate it.
So the DPW, in conjunction with the Wellfleet Board of Health, we held a meeting last week, and the transfer station is open at this moment for trash only. We are not accepting recycling. We did try to accept recycling early on, and there was no market for the product because it was all contaminated. So we have abandoned that. Recycling materials can be thrown out in the regular garbage, and we have allowed for the use of regular trash bags. So we are not requiring pay as you throw trash bags through at least April 30th at this time. We will reevaluate as we get closer. I know there's been some concern about other operations that folks want to see open at the transfer station. And at this point in time, we don't have the staffing or the ability to open up other areas of the transfer station, because what we really want to do is limit the number of folks coming in and prevent the spread of the virus. So we continue to reevaluate, and we will continue to do so moving forward. And if we can safely open up other operations at the transfer station, we will absolutely do so.
All right, I appreciate it. And I know that whenever any town operations are affected or reduced or reopened, all that information will be on the town's website. So just so people can go there to get the most up-to-date information. All right, thanks, Hillary. Suzanne, Community Services. Or anybody from the Council on Aging that may be on the line? Just for the community, the emergency management team is comprised of the police, the fire department, health department, DPW, community services, and town administration, just so the public has an idea of what our team's comprised of. We do interact daily via email and telephone conference calls to make decisions for the town and for each individual departments. And we do try to push that information out on social media and again on the town's website, which Courtney does a great job keeping up to date for us. So one more call for community services if they're on.
Looks like Terry might be on, but I'm not seeing Suzanne or anybody else.
Okay, great. If they do come on,
Oh,
I know.
Suzanne just came on.
Hi, Suzanne.
Hi.
Hi.
You are muted. You are unmuted.
Mike,
Mike, I'm having a little problem here with my technology.
There you are.
Do you want to
You're good now.
Okay, good. Community services, we have staff, limited staff, answering the telephone at the senior center between 8 and noon. And we are checking our messages all other times when we're not there remotely. We are continuing to have, at this point, two of our drivers are willing to pick up food from food markets or from the food pantry to deliver to clients. And we're also picking up prescriptions and delivering those to clients. It has to be prepaid. We don't handle money. We don't handle credit cards. And our phone number is 508-349-0313. If we don't answer, leave a message. The other piece is recreation. Decision has been made to close the skateboard park, the fields, the playground, the tennis courts, and the basketball courts to the public because of our inability to satisfactorily sanitize them between uses of people. And that's until further notice.
Okay, great. I appreciate it. And I do know that your department and Public Works are in the process of getting some better signage made up and to deploy it to those locations.
Correct.
Okay, great. I appreciate it. Chief Pauly, the fire department.
Yes, thank you, Chief. First of all, I would like to echo what Chief Hurley said. We have a really, really good emergency management team here. We're in contact daily. Mike and I are in contact almost hourly at all hours of the day, it seems lately. But we are working hard to provide the town with as much information as possible and give you guidance. I've got a few things here that I just want to reinforce. First of all, if you have a medical emergency or any type of emergency, dial 911. Please, please do not call the fire station business line and request assistance on a 911 emergency. There's a couple of reasons for that. First of all, we're not always here. If the crew is out on a call and the administrative people are off duty or not available, no one will be here to answer your phone call. It will eventually ring to the police department, but dialing 911 in an emergency is absolutely imperative. That speeds up the process of the dispatch time, and the dispatchers now are asking a series of questions on emergencies in terms of, do you think you might have COVID-19 exposure or not? What are your symptoms? Do you have a fever? Do you have respiratory issues? So there's a whole series of questions that are being asked, but that information is being typed into a computer and given right away from the 911 operator to the dispatcher. So there is no real delay in time of the dispatch, because as that information is being taken from you, the caller, it is already being processed into the next room, and they're already dropping the tones and doing the dispatch. So again, please dial 911. We have some folks from time to time that call in here, and it just really slows down the process. And it slows down the ability for us to get there to help you. We're currently under a series of Department of Public Health, Office of Emergency Medical Services changes and protocols. For instance, and we'll be doing a PSA on this in the next few days and get it out there through various outlets. But at this point, all patients that are being transported to Cape Cod Hospital, we will provide a mask for them during the treatment on scene and the transport. And our providers, our EMTs and paramedics, will also have a mask on, as well as our typical gloves for protection. So don't be alarmed, but that is a protocol that we have been instructed to follow, and it also protects the patient and first responders. Again, we'll be doing a public announcement on this and actually do a short video on personal protective equipment, what we may look like depending upon the nature of the call as we respond and as we arrive at your home or your business, what we would help you with. But again, so we're going to be putting that out there, and it will go out on local cable access, television station, Facebook, the town website, any type of social media. I'm hoping we're going to have that filmed Thursday, so be looking for that, and we will get the word out. Brush burning permits. You still need to have a brush burning permit. The season ends on May 1st. The fire chief has no authority to extend that season. That's up to the state, and we have no indication that's going to do that. If you'd like a brush burning permit, please call in advance and ask and talk with our administrative assistant, Teresa, or you can come into the vestibule of the building. There's a table there. You can fill out the brush burning permit itself. They're $15. It has to be cash or check. You cannot take credit cards, but again, that can be done right in the vestibule, and we can talk to you through the intercom system if you have a question. If folks come in for request a blood pressure check, we're asking that you call in advance also. 508-349-3754 is the business line, 508-349-3754. We are trying to limit the blood pressure checks to what is necessary. Obviously, if you have a concern, give us a call, and we will come out to the vehicle to assist you with that. Just a couple other things. Social distancing, we keep hearing that. It's not a buzzword. It makes a difference. Please stay at home, if at all possible, except for food and medications. This is really critical. If you saw what the governor was saying, there is some thought, and this is no guarantee, but there's some thought that perhaps the COVID-19 will peak in Massachusetts somewhere between April 7th and the 17th. But that is a statistical estimate, and there are no guarantees, and there's also no known output in this in terms of how long the peak will go, whether it'll go a day, weeks, several weeks, we don't know. And again, this is the best information that they have, but it's something that we should be on the lookout for. One last thing, look out for each other, stay in contact by phone, video chat, email. I'm new to this whole video chat thing. This is about the third time I've done it. And it does take some practice, but it works. Reach out to your neighbor, remotely, again, by phone or by video chat. Massachusetts 211 is an excellent website, excellent phone number, excellent resource if you have questions, as well as the Massachusetts Department of Public Health website. So we will get through this. The Outer Cape is known for fighting through adversity, and Wellfleet certainly is known for fighting through adversity. We're resilient and we're strong. We're also compassionate. We're here for you, and if you certainly have any questions, drop me an email or give us a phone call at 508-349-3754. And we're going to do the best we can to keep putting information out there through the fire department's Facebook page, the fire department website, the town website, and local access TV. Thank you, Chief.
Great, Chief. Thank you for that update. Next up on the agenda is here at the police department. Again, just want to reassure to the public, as the fire chief has, we are open 24/7. We are responding to emergency calls in town. Our operations have changed a bit. Our lobby is open to emergencies, but please understand any day-to-day business, anything that could be handled over a telephone or via email is the best practice right now to limit exposure both for the public and for our staff here at the police station. Most things can be done online. If you have gun licensing that you're concerned about, I know the state is pushing a lot of deadlines forward, both for gun licensing, driver's licenses, inspection stickers. So again, a lot of information that we're trying to push out to the public, and I know it gets overwhelming at times. But if you do have any questions, 508-349-3702 is our dispatch. And if you need to speak with an officer about any types of issues, we can answer those here. Also, just another a piece on the governor's advisory to out-of-state travelers to self-quarantine for 14 days. Again, that is an advisory from the governor. It is in place throughout Massachusetts. However, I'd just like to caution, because we are seeing an uptick in phone calls through our dispatch as to why we are not enforcing that. And again, I just want to just let the public know that that is an advisory from the governor. It does not give us any authority to stop motor vehicles or check to see how long they've been in town, out of town, or if they are self-quarantining. We are trying to get as much information out to the public via a message board, via social media, and via the town website. So again, we are working on this. I know it's frustrating at times to see people not obliging to the social distancing, or maybe from out of state that are driving around. But just rest assured, we are trying to get the word out in all venues possible. And again, as the chief said, I mean, the town is strong. We will all get through this together. Our main goal here with first responders is we're trying to keep our people healthy and safe so that we can continue our services here to the public. And again, I'd like to thank the town, the select board, the town administration, just giving us the support we need to move forward through this. And it's going to be a while. I think this is going to last a few months, and we will work through it here on our end. So I appreciate that. Anybody from town administration that has any updates or would like to speak?
This is Dan Hort. The Select Board has a meeting on Wednesday afternoon at 1 o'clock via the same platform that we're using here. At that time, I will bring forward some of the recommendations that have come through our emergency management team. We are recommending that we continue to have all town buildings, with the exception of the police station, closed through Friday, May 1st. We are asking that Wellfleet residents continue to follow the CDC guidelines as well as directives from the governor's office and shelter in place, practice social distancing. We're requesting that new arrivals to Wellfleet are advised to self-quarantine upon arrival for a minimum of 14 days. And for those new arrivals, to bring enough food and supplies to last 14 days so they do not have to overwhelm our grocery stores or pharmacies. I think I can honestly say, although this is a dark period, I've never been prouder of the staff and the volunteers and the residents of Wellfleet. The bright spots have been our residents who have stepped up to meet the needs of the community. You've seen it if you've been on social media. The staff has adjusted to the situation as best we can. The situation is fluid and changes daily, actually changes hourly, changes by the minute. We've got a couple of ways for you to communicate with us. We haven't been able to think of everything, so when we find something comes up, we need to come up with a solution. But if you have special needs during this period, please, and you can get this information off of the town's website, but please send an email to needs, and that is plural, NEEDS, at wellfleet-ma.gov. The same thing if there's something that you need from Town Hall or any staff department, please send an email to townadministrator at wellfleet-ma.gov. It's a difficult time for everyone. This is uncharted territory for so many of us. We'll get through this. We're a strong community, and we'll get through this. And that's all I've got.
Great, thanks, Dan. I appreciate that. At this time, that concludes the presentations and the updates from various departments on our team. At this point, through Courtney, I will open it up to any questions. Again, if you could either raise your hand or via the chat. And for those that are on telephone, what I will do is once we get through any of the questions where we can see them, we will open up the telephone lines and just see if anybody out there has any questions or concerns.
Okay, Chief Hurley. So first in the chat, there's a message from Harriet asking when the next meeting is. We haven't scheduled another community Zoom like this one, but we do plan to host more of them as regularly as possible. So stay tuned for that information on the website and on the Facebook pages. Janet Reinhardt has a question, so I'm going to let her ask that now.
Great.
Hi, you can hear me?
Yep.
So the questions I've been getting is, where is all this posted? And I know that you guys just everyone did a great presentation on what they're doing. But as of Sunday, I couldn't find this on our town website. So somehow between the DPW, the Council on Aging, Department of Health, if there can be links to all this information from our main town website, I think that would be great. If I'm wrong, I'm sorry, and maybe it's up there and I just didn't get it, but that's been the concern I've gotten from a lot of people.
So Janet, I'll answer that question. There is a main COVID-19 information page on the website. As soon as you go to wellfleet-ma.gov, there's a red alert that says COVID-19 information, and you click that and it leads you to the main page. The information for the Zoom was listed on the community calendar as we post any other public meeting. I know Chief Hurley shared it on Facebook, on his police department page. I think it was shared in the Wellfleet community space pages. So we did centralize all the information, and people can always call Town Hall if they do need help finding it in the future.
Okay, and did you do that like yesterday? Because Sunday I did click on that COVID-19 and I just didn't get the different links, the pertinent information, like the phone numbers that Chief Polly just gave out, or
So the
211 and that.
The phone numbers are on the town directory, which I did add to the red alert page. The town directory is listed there. All department phone numbers are also listed on their individual pages. So any other information, I mean, I update the page as soon as a department head sends me information to add. So if you go to the COVID-19 page on the left-hand side, there are links describing different things. Click through those, but if there's something you're not seeing that you think should be added, feel free to call me at town hall or send me an email.
Okay.
I'll put my
I
email.
will, yeah. Okay, thank you.
Great, thank you.
Looks like Hillary has something she wants to say, and then Kathleen Bacon.
I
Okay,
just
great.
wanted to add a few more comments for the business community. We still are processing building permits, septic permits, well permits. We are still able to do routine inspections for those services, and for any of our restaurants that are thinking about opening up for takeout service, we are happy to come out and conduct your pre-operational inspection. Just give us a call at the office or send us an email. Our office is manned 1 day a week from 8 to 4, and messages can then be pushed out through email to whichever member of the department you want to speak to. We have some bins outside for folks to drop permit materials off in. We process them and then put them back out for people to pick them up. So if folks want to continue working, we can continue to process those permits for them.
Hillary, while you're on, it looks like we have a question in the chat. They want to know what the rationale provided is for withholding community statistics from the Department of Health that you mentioned earlier.
So the Department of Public Health has seen in some communities where they are posting the exact number of individuals, it is easy to identify who that individual is. And there is some bullying going on, and the folks that are ill are taking on additional heat that they don't really need to take on while they're ill. So that is their rationale, to continue to protect people. It is safe to assume we have the virus in our community and it will spread. So I will think about posting, a handful or 2 handful, I'm going to see how we can release information that's not specific, but gives you an indication of how many cases there are in town. And again, those are only positive cases as tested through a testing center. There are a number of presumptive positives out there that don't go into the electronic disease surveillance system. So even the number that we would put out there wouldn't be entirely accurate, because we don't exactly know all of the cases out there.
Okay, thanks, Hillary. Kathleen Bacon, you're up next.
Hi, this is Kathleen. I just, want to commend everybody for the work that they're doing. Town staff that is still out there on the front lines of this. I just think it's remarkable. I also, to Chief Polly, want to commend Justin Kinshaw and the rescue that came to my address for their professionalism and the manner in which they're dealing with this situation. I'm very, very, very grateful. I myself am in a self-imposed 14-day quarantine, and so it goes. I basically have been in this situation since the 17th of March, when the Board of Selectmen declared a state of emergency for the town of Wellfleet. I think by doing that, we were telling our residents at that time that we were taking this seriously, and we are, and we continue to do so. So again, my thanks and gratitude go out to everyone out there. Thank you.
Great, thank you, Kathleen. I know, Courtney, you're reading some of the questions and comments in the chat room.
Yeah.
Just in case those that are on a telephone,
Yeah.
is there a new date for the town election? Dan Hort answered, town election date has yet to be determined. We are currently expecting mid-June, and I know to stay tuned for future select board meetings, as that will be a fluid situation on that.
Yep. And then somebody asked if there's a town or multi-town hotline being considered. I don't believe at this point there is. As far as a town, we don't have a hotline number, but we do have the email address needs@wellfleet-ma.gov, which was put in the chat here and is on the town website in a few locations. Looks like, and that Dan Hort said the town's main line, 349-0300 is the main line. And somebody wants me to let you guys know that these chat questions are saved and put on the town website, so you can go through these and read all of them afterward as well. Mike Trovato looks like he has something to say. I'll unmute him now.
Great. Hi, Mike.
Can you hear me?
Yep. Hi, Mike.
Okay, great. I also just want to echo the sentiments, thanking Chief Hurley and Chief Polly and all the first responders out there, also the emergency management team and all town staff for their dedication and loyalty. They've been incredible throughout this whole crisis. Wanted to just mention that we've just created a small business information guide to help small businesses that may be in need of these relief or loan programs that are being offered at the state and federal level. So we'll be constantly monitoring those and updating that information posted on the website today. And if anyone has any questions from the business community regarding this, feel free to call me at 508-349-0349, or you could email me as well. I also want to mention that every department has created a continuity of operations plan, which we're putting into a townwide continuity plan, and that whole thing will also be posted on the town's website. So,
Right. Thanks, Mike. I appreciate it. Just for those out there in the public, a continuity of operations plan, which each department has submitted along with the town, is just in the event departments have members that become sick, that their department will continue to operate with their next in line or their support staff. So we just have that in place so that we can all continue to function during this time. Thanks, Mike. Courtney, anybody else raise their hand?
Nobody has their hands raised, but oh, there is one. Gazelle is the name, so I'm going to unmute them. If I can. Okay, go ahead.
Hello, can you hear me?
Yep.
Yeah, I just want to chime in and say how obviously grateful I am for everybody's work in this crazy time. I just have a random question about food distribution. I know that the Fox and Crow has been doing everything they can. Excuse me, everything they can to get the food to the people that need it. I was wondering if they are overwhelmed at all. I had heard that they were just getting too much food, that they couldn't even deal with the amount of food that they were getting. And my question is kind of to whoever, is there a need to start maybe a separate kitchen to help people get food? Again, I don't know if people need it. I'm just a local chef wanting to help.
I can weigh in on that. I'm in close contact with Trudy from the Fox and Crow or the Common Table. They are keeping up with the need at this point. They are switching to a delivery only model from this point going forward. The 246 kitchen is also working to offer some meals to folks. Soups and stews are hopefully forthcoming out of that kitchen in the near future too. So it seems like we're meeting the need. And again, if anybody has more specific needs for food or resources, they can email us at needs@wellfleet-ma.gov, and we are certainly willing and able to help folks out.
Thank you.
Okay, so next is Mary Ellen.
Oh, hi. Can you guys hear me?
Yep.
Oh, yeah. I just, I think Courtney answered my question. I just wanted to know if there were digital signs posted on Route 6 advising travelers to Wellfleet to self-quarantine for 14 days. I haven't been out, so I don't know if they're up or where they would be.
Thank you, Mary Ellen. This is the police chief. Yes, we, through a request to MEMA, which is the state emergency management organization, they met our request for a loaner signboard, which came from Bridgewater and was delivered to the town. We are very grateful. That has been deployed on Route 6. It is displaying the message about the 14-day self-quarantine to travelers, and the town is in the process of obtaining our own message board outside of this event so that we can continue to update the town on various items. So thank you for that question, and that is out there.
Okay, thanks, Chief Hurley.
Great, thank you.
Mike DeVasto has his hand raised. I'll unmute him now.
Hi, Mike.
Hi. I just wanted to speak about the food distribution. I am meeting with a group of people every Friday, and that group includes the COA, the Lower Cape Food Pantry in Wellfleet, 246 Kitchen, the Mustard Seed Kitchen, and the Common Table. And if I'm leaving, and the Nauset food program that they're doing at the elementary school. And basically we're sort of in communication to assess the needs of the community. And so if more needs come up, we're in sort of a position where we can sort of respond to those and make sure that we have resources allocated in a way that's not redundant or overlapping, but we can address those. And right now, those are just conversations. We're sort of preparing for the idea that we may need a ramp up in the amount of food brought into town and how it can get here and how it can be distributed. But there's right now it seems like the needs are being met, and if in the unfortunate circumstances that we have a real surge in needs, we're all communicating, and all those groups are communicating to meet the needs if we can. So that's it. I just wanted to report that.
Great, Mike, I appreciate it. Just another quick question. I know sometimes some of the calls we're getting here, and obviously we're seeing it on this conversation right now. If people want to help, chefs, volunteers, do you guys have a central email or point they could contact you if they want to help?
Right now, the email needs, the needs, what is it? Needs at
Needs@wellfleet-ma.gov.
Right.
Okay, great.
Right now, I would email that. The situation is sort of fluid in that they're still sort of like this 246 Kitchen is just starting to figure out how they can prepare meals, institute protocols that are safe, how they can establish guidelines for who can be in the kitchen with them, the amount of people that they want to have involved to limit exposure. And so those sort of things are sort of being worked out right now. At some point, I think we'll probably be able to direct volunteers to where they're needed. But right now, it seems like it's more of an issue of sort of developing these protocols and systems so that, when we do need volunteers, there's some place we can direct them. And obviously, it's a sensitive situation. We have food being prepared or distributed to the public. Well, there's this potential for spread of the virus. So everything's being looked at extremely carefully by all the parties involved. And so I don't have an answer for that right now, except that if you are interested in volunteering, I think the only way to sort of put your name forward is through that needs@wellfleet-mass.gov email. And as things progress, we'll see what we need and how we can get people involved.
Great, thanks, Mike. I appreciate it. So again, that's needs, NEEDS @wellfleet-ma.gov.
Yeah.
For anybody in the community that's looking to move forward and help. Appreciate it.
I would just say that I wouldn't be surprised if somebody doesn't get back to you on your offer to volunteer right now, just because of everything that I had said before, where we don't really know, we don't really know what the needs are going to be right now. Right now, currently, things are being met. But, we want to make sure that people who are symptomatic or having problems or unable to leave their house or should be self-quarantining have access to support systems. So I foresee a surge in demand, and that's what we're preparing for. But right now, I wouldn't be surprised if you didn't get an email back, because there's not really the infrastructure yet.
Okay, great. I appreciate it. And I think that echoes, I can probably speak for our team and individual departments that, again, we're just asking for the public's patience. I know sometimes information or return emails or calls may not come as fast as they may want it. And sometimes if you just need to reach out a second time, because many of us are overwhelmed with certain needs that are going on within town. There was a quick question about the signboard again, the electronic sign. The one that the community has seen in the past on Route 6 was a loaner, or actually Barnstable County had bought a few and they deployed them throughout Cape Cod. So the one in past years that you have seen in South Wellfleet is owned by Barnstable County. The town has, as far as I know, has never owned an electric signboard. And we have purchased one last week so that we can, have a reliable one for town, and have one to be able to push out the information.
Okay, nobody else has their hand raised right now. So if you do want to ask a question, please unmute yourself and ask it. Just be respectful if other people are trying to talk.
Is there a way that people that are on telephones can unmute themselves, or do we have to do it all here?
They should be able to unmute themselves. Mike DeVasto has his hand up again. I'll unmute him.
Hey, I just had a realization that I don't think that, can everybody hear me?
Yeah.
Okay, I just don't want the needs at wellfleet-mass.gov to be overwhelmed with volunteer messages, because that email actually really should be served as for people who are in need. So I'm not sure if there is, I just kind of realized that might lead to like an abundance of people volunteering and sort of having to filter through that. So I'm not sure. I would say, actually, if you want to volunteer, maybe hold off, and maybe we can figure out some way this Friday when we meet again to set up a separate email address for people who want to volunteer, and actually leave that email. And this is just my suggestion. We have not discussed that, and I shouldn't have said, just email that address. But I know how active Wellfleet residents are in their volunteerism and how much people want to help, and that realization sort of hit me. I don't want to overwhelm that email address with volunteers when people who actually need to use it to receive services should be heard loud and clear on there. So
okay, great. I appreciate that. And again, if anybody that's either on today or this will be replayed on the town's website and on various social media spots, that if you are looking to volunteer, if you could just hold at the moment until we could, as a community, just get a little more organized to be able to sustain that, especially while also trying to abide by the CDC guidelines that are currently in place. I know we also have a question on this type of meeting and going forward. We did try to get the word out via Facebook pages and the town website. And we are looking, hopefully maybe weekly when the select board does not meet, to hold these with the emergency management team. And once we have another time and date, we will try to give a few days notice to push that information out to the community.
Yep, and the town website should really be everybody's first place to go for information after calling town hall. The town website is the place where we post all of the updated information. So if you have contact with people who you feel can't get onto the internet or, you know, can't find this information, give them a call, reach out to your neighbors and tell them that these things are happening. You do have the option to call in, as some of you are. So this is a platform that everybody should be able to access, and feel free to call town hall if you have any questions about it. Nobody else has their hand raised, so I guess, Ginny, did you have a question? It looks like you
No,
yourself.
no.
Okay. Anybody else has a question? If you want to unmute yourself and ask it, feel free. Mary Ellen, go ahead.
Oh, hi, I've got a question about masks. Should we be advising residents to possibly wear homemade masks to try to mitigate the spread? Because even though the CDC advises against it, I read an article, I think it was in the New York Times, that you know, they hoped it wasn't going to be one of the great tragedies of this pandemic. The fact that the U.S. Surgeon General advised the public not to wear masks because they were afraid that the first responders and healthcare workers wouldn't have enough. Because evidently there is evidence, even a homemade mask, it does several things. It could remind the wearer not to touch their face and, you know, further spread the virus. And also, if someone inadvertently coughs or sneezes, it could protect people around them from, you know, the aerosolized particles. You know, I didn't know what you guys thought about that. Because personally, I'm going to wear one when I go out. I haven't really been going out much at all. What do you think?
Hillary, if you're still on the line.
I'm here. We have not received guidance from DPH or CDC about wearing face masks out in public. I think at this point it is an individual choice. If you have one, certainly feel free to wear one. I don't think we would ever discourage that.
Yeah, you know, I noticed there were some postings on Wellfleet community site about it, and I mean, I think it makes sense, and it's completely understandable why the Surgeon General advised against it, because they were, you know, and there's still not enough personal protective equipment for the frontline workers. But I don't see any harm in just, you know, the general public wearing whatever masks they have, homemade masks, bandanas, anything, just to, you know, at the very least, it would remind people not to touch their face. And it could prevent them from, you know, spewing germs if they were asymptomatic and walking around, you know, they wouldn't spread it as much. Okay, thanks. Anyway, I'll be
Great.
wearing one.
Great, thank you. Just if anybody is on a phone and is having trouble, because again, this is new technology, trying to ask a question, please either email or call whatever department you may have the question for. I know some are having trouble trying to unmute their phones to speak during this, and I apologize for that. Anything else, Courtney? Do you see anything else on the board?
I'm not seeing anything else right now.
Okay, great. Well, again, I appreciate the emergency management team for participating in this today and moving forward. You know, we definitely will get some more of these out to the community. This will be replayed on the town's website, and we will get it up on various social media sites, so those that were not here today can listen in and see that your town team is vibrant and we are moving forward with this. So I appreciate everybody participating today. Chief Pauly, any last remarks?
No, again, I would like to thank everyone. We're going to push this out, as Chief Hurley said, as widely as possible. And again, you know, we're all struggling. I know I struggle with technology, let's put it that way. So just be Pete, please be a little bit patient with us, and we'll find a way to be as communicative to the community as possible.
All right, great. Thank you, Chief. And again, thank you to the community and thank you to the emergency management team. Everybody stay safe. Thanks, Courtney.
Thanks, Chief.
Thank you.